Important stages. We talked about it yesterday, so go back and review yesterday's talk. The arousal is that first stage in terms of getting your orgasm, okay? The excitement stage, okay? So you are going to get a step by step demonstration of how arousal works, which means you are not going to miss a step because each step is going to be very important. And you're going to have to observe, watch, and learn so that you can achieve your partner reaching that orgasm. Okay? Now, yourself also, you need to learn because you need to reach your own orgasm by yourself. I always tell people that. But a lot of times, some people don't believe in it. And I'm like, okay, whatever. But I need you to focus on this because I'm going to go slowly. And I need you to understand that each step is important. I'm going to try not to go into too much detail, but I need to send home the points. So just bear with me. So, what is the arousal? The arousal is a mechanical, non emotional stimulation to the erogenous zone, okay, to achieve blood flow to the genital organs, okay? And I said it's a mechanical and I said it's non emotional because it's like a job. You've got to be targeted, you got to be focused, you got to be on point. Otherwise, you'll get fired. But you need to take this to be the time where you're, again, focusing on your partner, watching for the signs, watching for the response that your partner is supposed to give you. And then you can know whether you're doing the right thing and whether you can move on to the next few steps. So right now, the first step is to arouse your partner. And we all know about foreplay. We all know about your getting yourself in the mood, using your mind. We all know about that. But right now, I want to just zoom into the discussion of the arousal because I think we rush by it too quick, which will affect the orgasm. Okay? So it's a non-mechanical, sorry, it's a non-emotional, mechanical meaning like at work, you do things mechanically without even thinking. This is doing certain things without thinking. And that is stimulating the erogenous zones. Okay? It's non-emotional because you have to be able to think clearly. There's no guesswork here. You have to be able to know what you're doing. So the first thing you have to understand is it's a non-emotional mechanical stimulation to the erogenous zones to achieve blood flow. Now, why do we want to get blood flow? All right, so blood flow is important. We talked about it before, getting the blood flow going, getting the heart rate going, getting the muscle tension, getting that feeling of, ooh, something's going to happen when someone is actually exciting you or trying to get you to engage with them sexually, right? So you start changing because all those chemicals and all those neuro hormonal responses start to get turned on. Remember, and your brain is lighted up, and you've got to make sure that you stay focused and interested in your partner because if you don't, you can lose the desire. But this is when desire is building up. But the arousal, which again is what you are doing to make that person respond sexually to you, is basically getting blood flow to the genital. Okay? So the genitals are, we know, the female genitals. We're not talking about men right now, but men need to know this because you guys need to be aware of this. Women need to know this for themselves, and women that need to do it for their partner, you all need to know this. We all need to know this. So please pay attention, please. So the blood flow is the main source of getting your chemicals, hormones, juices to the genitals. So to get blood flow, you have to have a good heart rate. To get a good heart rate, you start doing the erogenous zones, which we talked about before. We talked about erogenous zones. So you're stimulating those erogenous zones. But the zone that we're going to talk about, the erogenous zone we're going to focus on today, is in the vulva. Okay? Because the vulva is where you're going to watch for the signs of response to your stimulation, to your arousal. So the vagina is where the vaginal lubrication is going to be seen or felt. So that is when you know you're on the right track. The end game is you've got to get that vaginal lubrication. If not, you're not anywhere. You're going nowhere. I'll say it again. The vaginal lubrication is what you're going to know is welcoming you to go ahead and engage sexually, right? Now, I do know that this is for adults, right? Consenting adults that are engaging in sexual activity. So this is not for children, not for people that are doing anything bad with sexual activity. This is for educational purposes. But I do want to make a note and point out that you can stimulate mechanically and non-emotionally and get vaginal lubrication. So you've got to be careful. This has to be between two consenting adults. That's what I want to point out. This is not for someone that doesn't want it. It's for someone that wants it, okay, in a relationship. So the blood flow is going to go to the genitals. It's going to go all over. You're going to feel, like I said, the heart rate. You're going to feel the muscle tension. You're going to feel what we call the sex flush, which is a redness that comes over your chest. You can sometimes see it. You get red, you get flushed. Some people call it the blood flow, okay? So there's that, the blood flow. You have that increase in redness. And you can actually see sometimes on the breast even distended veins, all right? But the key here is that there's a redness that's telling you that the heart rate is going up. Even if you can't feel it, you will notice it and you'll see that red flush. There's some redness if you have lighter skin, right? But that is telling you on the right track. When you're getting someone's heart rate up and the person is feeling sensitive to the engorgement, right? The blood flow going to the genitals, they're actually feeling that. It's becoming more sensitive and they're feeling that sense of, whoa, something's going on. Now, you as the person doing the arousing, you are trying to make sure that you're looking for those signs. The heart rate, you can't really tell, but the flushing you can. Okay, so look for that redness, look for that swelling. Sometimes I say the breasts actually enlarge, especially if they're younger. The breasts do enlarge a little bit more. The older ladies that have had breastfeeding and stuff, it's a little bit more subtle. But you have to watch out and see the response and, you know, hear the response of the partner that you're trying to arouse. When you get the genitals engorged, we're talking about the clitoris, right? Number one. Remember the clitoris? So we're talking about especially the glans clitoris, the shaft or the body of the clitoris. We're going to see that get a little bit engorged and get bigger as blood flow is getting there. Okay? And so we'll also see it in the erectile tissues, which we talked about before, which is the bulb. You're going to see that. Now, you're not going to see it in terms of seeing the actual whole clitoris. Remember, we only see the top part of the clitoris. But you might see it in the lips and in the whole area of the vulva, which is the area, which is where the vagina is. So the vagina is actually the opening into the tube-like structure, which is the vagina. The whole outside where the lips are encasing the vulva is where we have the actual vulva, which people always call the vagina, but let's call it vulva for medical reasons, okay, to clarify the anatomy. So the vulva cases or holds the clitoris, right? But you're only seeing the top part of the clitoris. That top part of the clitoris is going to get a little bit bigger, a little bit shinier, and you're going to notice that that area is changing and therefore responding to the arousal, which is the stimulation of the erogenous zones. And this again is an erogenous zone. So the vulva is an erogenous zone. The vulva, right? The V. Okay. The clitoris is one part of the genitals that will be aroused. The other part of the genitals is the lips, like I said before. So remember the lips? Let's see if I can draw that. I am going to take this blue. See? So remember I said before that the lips actually are the inner part of the vulva. Is that big enough? Can you see that? So that's the inner lips. The outer lips are out here. That's the outer lips. But the inner lips is where you want to focus, because this is what will take you to the clitoris. We talked about that before. So that's the clitoris at the top, right? The glands, and that is going to get a little bit enlarged, shiny when it starts getting engorged. This also does get enlarged. But remember, the rest of the clitoris is behind here. So that all does contribute to the clitoris getting enlarged. Therefore, the lips get enlarged. And when the lips get enlarged, you can assume that the clitoris is getting enlarged behind, right? The rest, the ball, the legs, everything, right? Remember that? So you want that, it's small, but imagine it magnified, behind to also swell. And it's going to, like I said before, grip. These two bulbs are going to grip the opening of the vagina, which is going to be in here, okay? So when you're getting aroused, these lips are going to get bigger and fuller. Now, the lips are an erogenous zone. So you definitely want to note that so that you are actually aware to stimulate the lips plus the glands, penis, and the hood or the body of the or the shaft of the clitoris. Again, this is the part here that also needs to be stimulated, this part. So don't forget, it's not just the tip. The whole clitoris needs to be stimulated, but the most important part that I'm talking about right now, the whole thing needs to be stimulated, but of course you're going to see that with erogenous zone stimulation. The most important part is the glands and the body, and that's what studies say. All right? And again, I'm using the same book that I used last time, David Lambert and Quick, okay? If you need the article, let me know. I'll send that to you. It's a book, really. So the lips, they say, are as sensitive and as arousing as the clitoris. So the clitoris, if you didn't know this now, is connected to the inner lips. So those inner lips, once you can stimulate the inner lips, you're stimulating the clitoris too. So please take home note, clitoris, lips are connected, and studies say that they are almost equally sensitive and arousing and pleasurable to the studies, the women that run the studies, and the intensity is pretty comparable. So if you ask the ladies, they'll say both of them are important. Both of them give them intense orgasms. So if you're missing that, I need you to note the inner lips. Now the outer lips, no, they do get engorged, but they're not really involved as much as the inner lips. Okay? Now remember, we're talking about the vulva. This is the vulva. Now we have the urethra and we have the vagina. Okay? Then we have the anus. So the urethra is also an erogenous zone, right? The U spot from our previous talk. So remember that when you're stimulating, you want to take each of these areas separately and you want to be very gentle. The most gentle will be the glands and the body and the inner lips. You got to be very gentle there because it's very highly innervated, a lot of nerves there. So you don't want to go too rough on that in terms of stimulation. So very minimal stimulation. Just remember that too. Same thing on the inner pink area. All right. So remember, these areas are pink. And when they are pink, it means that the mucous membrane, and they also are getting engorged. They're also getting involved in the activity of blood flow. Okay. So when blood flow is occurring, we are getting blood flow to the clitoris, the lips, and the pink, including the vagina, the anus, and more areas of the body. But right now we're focusing on the vulva. End game is to try and get blood flow to this area. So you're stimulating, again, these areas, including in between the in between the urethra and the vagina. And remember, the 2.5 centimeters, they say if it's more than 2.5 centimeters, it's hard to get an orgasm. If it's less, it's easier. So if you have some long distance between the two, just know that you need to stimulate the area a little bit more consistently, because it can be more difficult to get that orgasm when it's longer. But that's not what I want to focus on. What I want to focus on is the actual stimulation of these areas. So when you're stimulating, you're expecting to see lubrication in the vagina. And what is lubrication? It's a transudate. It's when the blood flow gets there, the watery part of the blood gets into the vagina, and then it starts to seep out from the vagina. And that's how you know you're on the right track. So when you're stimulating all these areas, the anal area, the area between the anal and the anus and the vagina is the perineum. So you want to stimulate there. You want to stimulate here. Again, the U spot, the urethral meatus. All these areas are going to help increase blood flow, but be gentle, right? Once you are stimulating these areas and you notice the lubrication has increased, you're on the right track. And remember, you don't have to just stay in the vulva. You can also stimulate other erogenous zones, right? The lips, right? So you're kissing and you are teasing the lips. You're also going to involve like the nipples, and the nipples itself separate from the areola around the nipples. So those two need to be stimulated also. You also want to stimulate maybe the ears if they like that. Some people like it, some people don't. The feet, if they like that. Some people like it, some people don't. Communication there is very clear. You have to find out whether they enjoy that or not. And like I said, the anus also. The anus is highly innervated also. So all those areas are going to be stimulated in addition to this. But this is the focus right now, because I want you to note that this is how you're going to see whether your person is responding. Okay? And take note of this also. They say that deep interior vaginal stimulation. Remember the G spot, right? The O spot, the A spot, all that going deep adds to the blood flow and the chances of getting that orgasm because of the intense response that you get. Okay, so whether it's with your genitals that you're stimulating each other, or your fingers, you want to make sure that you're also addressing the G spot, the U spot, the A spot, the O spot, the P spot, all those areas, right? These are all supposed to be gently stimulated. Okay, so the reason why I'm saying this is in phase one, if you don't get this response, you're not going to be able to go over to phase two, which of course we talked about, the plateau or the orgasm. All right. So that plateau is where we're getting all of this engorged to the max, right? And then there's a particular point you have to now stimulate, whether it's the clitoris or the erogenous zones intensely, physically, to make sure that the orgasm happens. It's after this happens. You don't do it until you reach there. And you don't stay on these too long, because if you stay too long, it fizzles out. So the key is to know when you're engorged and watch the signs of engorgement, which I'm going to go through with you, because I had to print these out and they're so detailed. Now, I do not know if you want the details of this, but I'm going to give them to you because I think that this will be very helpful. So we have the response, the description, and the stage of that of what happens. Okay. Again, if you need this information, let me know. I can send this to you. You can get a copy of this. Men and women, we all need to know this. So just I'm taking time to do this because I think this is very important and I don't believe we know this. So the response, the clitoral erection and elongation is a response you're going to see. And that is where the shaft and the glands are pulled back against the symphysis, which is pulled against the bone in the pelvic area, and the glands may disappear under the hood. So it might disappear a little bit, but it's because it's getting bigger. That is something that you have to look out for, right? That's number one. Number two, and I'm not going to go to two because they have quite a few. Actually, let's start again. Increased vulvar blood flow. That's the response. So that's the first thing you want. Color of the genitals become redder, engorgement of the clitoris, both the superficial glands and the body, and the crura, the wings, the bulbs, the legs, and the labia minora, which is the inner lips, become redder, which consequently becomes more sensitive, slightly engorged, and separation of the labia majora. So the labia majora is sort of like separated away. That's the increased vulval blood flow, which is what we want. Increased vaginal blood flow. The color of the vaginal walls become darker also. And that's all in the plateau stage. This is all getting to the plateau stage, getting from excitement to plateau. So this is what's happening in the plateau stage, where you know you're going to be almost going to the orgasm. Clitoral tumescence. Texture of the glands smooth due to slightly increase in the volume. The clitoral body becomes firmer. So it becomes firmer because it's full of blood. Again, this is getting into the plateau stage or early arousal phase. Like I said a little bit earlier, the clitoral erection and the elongation, the shaft starts to pull back against the bone and it starts to disappear a little bit because it's getting bigger. We're still in the plateau phase. So the cervix will send secretions, right, to get the vaginal lubrication going. The uterus also does, and even the fallopian tubes do. Okay? Not everyone does that. Some people might do more than others. Whether we're going to get into the female ejaculation later on, we can talk about that later on. But those are involved also. But right now, we usually just get that cervical mucus secretion, which is a little bit more of a creamy discharge that we can actually see during this stage. So another response is increased lubrication. So you get the cervical mucus secretion, the vaginal wall secretions, and then there's increased transudate from the vaginal transudation, which means the labia minora, and the whole area becomes moist. Okay? Here it says that this is happening, progressing to a maximum, but declines if there's prolonged plateau phase. So they're saying that if you continue and don't go to the orgasm, there might be a decline in the vaginal lubrication, which can also be a sign that something is going wrong because the person is now not getting as aroused. So it's a decrease in the arousal. So you really want to take advantage of when the person is maximally lubricated so that you can actually get your chance of getting to the orgasm higher. The clitoral bulbs, that's another response you're going to see, engorgement through the arousal, often visible in the change in the vestibule. So you'll see that the bulbs will grab the vaginal opening and hold on so that you'll know that you're now in also the arousal stage, again, going to the plateau stage. Anal engorgement, where you'll see, again, the size of the anal area will get a little bit fuller, okay? Tenting of the proximal vagina. So the vagina inside will become like a tent, right? It elongates, and that also is a response in the plateau stage. The labia majora, lateral flattening, again, that flattens out, in the stage of the plateau. Dilatation of the cervix actually opens up, right? And those are for people that really have not had kids. The os will open up, but again, that's up to um, some of the younger population, the people, the women that have not had any kids. The women that have had kids, it's open already, so it's less detectable. And again, these are things that have been studied. So this is the only information I'm giving you, so you know that there are things that do happen during this arousal stage. The vaginal floor muscle is a response. It starts to contract voluntarily and involuntarily, flexing, right? And the voluntary, which is, I call it the Kegel exercises during this phase, is very important to increase the arousal too. So always add your own voluntary Kegel exercise during this process too, to increase blood flow and increase the chances of getting that orgasm. Clitoral vibrational sensitivity. So this increases during arousal. So you already know your clitoris gets very sensitive. Then the breasts do also engorge. And like I said before, you get some flush. You can see some veins dilated on the chest. And then you'll be able to note that that person is responding well with blood flow. Okay, so I will continue this tomorrow. I wanted to make sure that I started this today. I don't want to go into too much depth in terms of focusing on anything today except the fact that you're going to have to be aware of the engorgement and the sensitivity, and note that there's that plateau phase where this is happening. And so you have that window where you can actually improve the chances of having an orgasm by making sure this is happening and then staying consistently on that area for a short term, increasing the stimulation, whether depending on again the erogenous zone that you're focusing on, and if it is in addition to these, the reaction should be that orgasm. But I do want to continue that tomorrow so that you'll understand that there is a focus. So I've reached the point where I'm going to tell you tomorrow the point where you need to know when you stop actually stimulating so that you can actually allow the orgasm to happen. Because sometimes you continue going, you overstimulate. But we'll talk about that tomorrow. Okay? All right, guys. Have a good night. Take care. Bye. A lot of times, some people don't believe in it, and I'm like, okay, whatever. But I need you to focus